I don't know. Well, we might go that long. I'm not sure. Michelle might have more to present than I would think or than I thought, but we'll see.
Hi, Scott. You are live.
Great. Thanks, Nicole. Hey, Nicole, we've got one guest presenter. I don't know if she's going to have any slides or not. I didn't get anything from her in advance. It's Michelle Ponce with the Association of Community Mental Health Centers. Can we give her the ability to share if she needs to?
I will make sure that that's set up so she can share.
Okay, thanks. Hey, Joan,
Scott, how are you?
I'm good.
Good.
There's one on the line that's just a phone number that's ends in 0920.
Scott, this is Claudio. I'm driving, but I'll join online here in a minute.
Great. Thanks, buddy. I just wanted to verify who it was. We don't quite have a quorum, so we'll hold for another minute or two and see if we get a little closer. Mary, I see Sarah's on, Jason, Tom, Joan, I already acknowledged, and Claudio's on. 1, 2, 3, 4, 5, 6. That gets us 7. We can get one more. We can conduct some business. We'll give another minute and then maybe we'll start and see if we get our 8th member while we're meeting. Well, that's been a minute. Hey, Melinda, I heard from Michelle this morning that she was, we're going to talk about the association's legislative agenda as well, but I don't see her on yet. So could you just email her and say she could sign on pretty much whenever she's ready? I may have told her to wait till 1:15. Oh, hopefully that was a message received. Okay. Well, I will call the panel to order. Happy 2025. Great to see everyone. Thanks for making some time to meet this afternoon. We've got a relatively brief agenda, but a couple of items we wanted to provide updates about and get a little direction based on recommendations from the panel on an advisory committee for the new hospital as well. So we'll try to proceed through there. We're still one short of having a quorum to vote on minutes. We do have two sets to approve, but we'll keep watching for an eighth person to do that. So we'll come back to minutes. Oh, there's Mr. Bennett. We'll let him get signed on, and then we'll come back and do minute approval here in just a second. But we'll start with our updates. Tanya, it's a little earlier than I would have thought, but if you're ready, if you want to provide an update from the county on construction.
Sure, I'd be glad to. So good afternoon, Tanya Cole, Assistant County Manager. So just as a brief update, as I mentioned last meeting, the County Commission awarded the contract to Key Construction. And so all of December, we were just finalizing that contract documentation. Just this week, we had our kickoff meeting with owner, architect, and contractor. And so that was basically a 2-hour meeting. What we went through in that meeting was just kind of introducing the entire project team. So that was, of course, KDADS, County, Key Construction, the design team, which include Pulse and Tesserae, and then all the subcontractors on the design team as well. We went through very briefly through the expanded project detail, and they provided us with 3 versions of that. They have a critical path list. They have an expanded list, and that's about a 30-page project listing that lists out everything that's included in the entire project. And then they have a collapse list, and I'm happy to provide you all with that if you are interested in looking at any of that. But the good news on that is it's set to start next week, being on site, and then their end date is, I think, 10/27 of 2026. So that's the projected timeline of when the mental health hospital will be finished and then turned over to owner. We have, they provided us with, and I think you may be interested in, Andrew, are you able to pull up the phasing document that they provided us with? I thought you might be interested in this. They color coded how they plan to phase out the project. And so I wanted to provide you with this because I do think it's a little bit interesting of how they plan to kind of attack the project. So as you can see, they will start kind of in the middle, the core area where we will have 2 levels there, gym. And so you'll see they'll start there. And then of course, 1.1 and 1.2, and then they're going to go around there to the west. So then 2.0, and then they'll start on the fingers of 2.0. Then they'll head north there, 3.0, and then they'll go around west, and then 5.0. Then, of course, will be the east side. And that's how they plan to phase out the project and do the construction of that project. So I thought that was a little bit interesting to share with you all. We will get the conditional permit, should be able to get that next week. And so they do plan to be on site. Key plans to be on site, and with the conditional permit, we're asking for earthwork to start. So that's site grading, and then excavations for underground utilities work to begin, and then later, then of course slab placement, and of course they'll be then on site to put up their fencing and parking lot paving, and then of course later structural steel erection. And then later on, we will, as this process happens, then we'll get our final permit. And I think we're working on signage to be placed out there. I think Scott's just finalizing the name for the mental health hospital with the governor's office. And then I'm not going to steal Scott's thunder, but we did talk about groundbreaking, so I'll let him talk about the groundbreaking piece. So those are my updates, and happy to answer any questions. Of course, Andrew's on, as well as Irina and Scott, who are part of the process as well.
Yeah, thanks for that update. Any questions for Tanya about that part of the update or the construction? I don't have that much thunder about groundbreaking, but I will talk about it here in just a second. Well, Tanya will stay on. If you come up with a question, we'll keep moving through our project updates, and then we'll go back and approve minutes since we've got a quorum now. Thanks everyone for getting signed on. Appreciate it. Irina, would you like to provide an update as acting superintendent?
Sure. Good afternoon, panel. I think today what we wanted to, obviously the biggest update was what Tanya just shared, and that's a great progress in moving forward. We also had our Director of Facility Services join, and that's very timely with the start of the construction. But what I wanted to bring up today is start talking about a structure that we would like to put in place to have continuous involvement of the community and advisement, especially since this panel is scheduled to have its last meeting in March. And what we would like to do is set up basically two groups, a Citizens Advisory Board and a 501c3 foundation. With the Citizens Advisory Board, the goal is to bring together people who care about improving the hospital and supporting it, and supporting the patients. The plan is to have about a maximum of 15 people so that we can actually can have the things moving. And we do have similar groups at Osawatomie State Hospital and Leonard State Hospital, and we thought that it would be good to bring folks that would sort of be the family and friends representation, and then also professional partners, as well as a few key folks from the hospital leadership. The idea for this group is to provide ideas, guidance, feedback directly to the hospital leadership, but also make recommendations for funding various initiatives through the foundation that we would like to discuss today as well. So really who we are looking for is folks who have interest, obviously, in supporting the hospital as community members, professionals in mental health and healthcare in general, law enforcement and other stakeholders in the community, and really also make a point of bringing people who do represent the voice of customers. And the idea, again, as I said, is that this group would work alongside the formal foundation that we would like to establish, which is going to be a non-governmental organization that would allow us to apply for grants, accept donations, and fund programs and projects that directly benefit our patients, but cannot be funded through the general hospital fund budget and general state fund. In order to set that up, we would need to identify organizational board members. Hopefully, we would get some volunteers who can help us with establishing the process to make it happen, file for corporation status with the Kansas Secretary of State, put together the articles of incorporation and bylaws, and then file for the 501c3 status with the IRS. And with that, I would like to see if within the panel itself, there are people who might be interested in continuous support for the hospital, either as part of the Citizens Advisory Board or the 501c3 Foundation, or possibly both. Or maybe you could, you have ideas of who you would like to recommend that we explore as members for either of those. Okay, great, Joanne. Awesome.
Yep, just expressing interest. First, you can think about it. I think we've got a little of a write-up as well that captures pretty much what Arena presented in terms of the purpose. And do we have a sense? I mean, I know we'd like to have this maybe not in place, but at least underway after March when our charge is complete. But I don't know that it would pick up right in April. It may be a couple of months down the road as we're in construction. So this may be a little bit of a gap, but I think over the summer, certainly before we open, we'd like to have a functioning group. So to help as we go through those kind of final stages of opening as well. Any other thoughts or suggestions, people to reach out to? You don't have to volunteer them. You can suggest that maybe it's somebody we ought to reach out to. NAMI's certainly been interested and participated in a lot of our town hall meetings, and is kind of a good group to get to the friends and family and people who benefit as well. But if there are other organizations that we should reach out to or individuals we should inquire to. And keep thinking about it. I think maybe we'll send the little write-up that we had, Arena, to the panel, and then that might spur some ideas as you think about it or interact with folks. But and do also think about the provider community. ComCare, certainly, Joan, you're valuable, but even private providers, we talked about that before too, based on Claudio's suggestion. There might be a good role for that. Universities as well. A lot of the training stuff that we're working on be important to have that embedded as well. Any other updates that you've got for today, Arena?
No, that is all my updates. Thank you.
Okay. Thanks, Latasha, for being interested. Let's see. So my updates, just a couple of things like Tanya mentioned. So as we're starting construction, and we can actually get on the site to work, you need to think about a groundbreaking to recognize the effort that have been put in and acknowledge the starting of the project. We started to look at kind of dates that would work. We certainly want to include the governor as much as possible. So there's a process that I have to follow to make a request. Some things will pivot around that, her availability. Also, we've had such tremendous support from legislators from the area that we'd want to have them participate as well. That creates a different set of issues around availability. They're on a very compressed schedule for this session and have very few scheduled days off, and their plan, at least their public calendar is that they're working on Fridays and Mondays, which is a little atypical as well. So we may be pushing out into the spring when some legislative members would be more available, and it's just a lot to coordinate, and we're building on a field where there's nothing there now, so it might be good to have a little something there, at least access, before we get going. But I'm making the request to the governor's office, I think today or Tuesday. So we'll see what her availability is. And then we've looked at the legislative calendar. There's some open days at the end of February, which feels a little early. And then into March, late March, when they would be actually adjourned. So I imagine we're looking more at a March date than February. But again, we'll keep you all posted. It sounds like we arranged it all for our last meeting to be on the site, and we kick off construction, and then we all go home. But that just worked out that way. But we'll keep working on that to make sure, and invite everybody who's been a part of the project, because it's a huge lift and a big a lot to get to this point of actually turning over some dirt. The other item I had was just legislative updates for the session. Again, we've made recommendations, and we've been trying to embody those in our legislative platform. The main thing that we're working on along those lines is getting the hospital named and created as a state agency so that we can build its own budget and have that structure in place well before we start operating. So we're on our, I don't know, third or fourth draft of the bill language to create the hospital and identify its functions similar to Larned and Osawatomie, and then to give its name and I think where we're landing, at least for the bill draft, is South Central Regional Mental Health Hospital. So we're working on that. I think we'll probably have it done and ready to submit in as a bill draft middle of next week, Wednesday or Thursday. And then will get us in the legislative process. I briefed the committee where we're going to have this bill introduced, House Health and Human Services, Wednesday, or maybe it was yesterday. No, it was yesterday. And so they're aware of it and seem supportive of the concept. So we'll get that going as well. And then the catchment area was maybe one thing that we've talked about before. We've drafted the bill so that we could accommodate the catchment area, but we're also thinking, let's get the hospital set up first, and maybe again, as we look at the flow of things, how we do admissions and can transfer people from hospital to hospital. We maybe don't need the catchment area identified in the bill. We can do it in regulation. So we're still working through that, but it's certainly in the spirit of the recommendation from the panel to focus on the counties surrounding Sedgwick County, but also being a little bit in tune to, we don't know everything about what will happen once we start admitting. So to have some flexibility there as well. But that's moving along. If the bill comes up for a hearing, or when it comes up for a hearing, you be more positive. Certainly let all of you know, and it'd be great to have your support either by letter or testimony to again, this is not the kind of support that it's in the spirit of the support we've been getting about funding and building this thing. Getting it named certainly important too, but want to again give you an opportunity to recognize the project as well. The only other thing I wanted to mention in the budget or in the legislative as an update, a little bit outside of our scope, but just because it's part of the dialogue. So we are in this really expedited legislative session, which is generally a good thing, I think. But the other side of that is that there's a very compressed budget review timeline that's pretty different than prior legislative sessions and prior fiscal years. So let me start with some of the good news. Good news is the governor's budget that was just introduced this week has all the funding for the hospital project. We're well on the path. It's all allocated. It's in there as we expected. So that's great. Slightly less positive news. The legislature is working to write their own budget, separate from the budget that the governor's presenting. And again, that's fine and certainly within their authority to do so. But where they're starting has a couple things that are concerning about it. One is that they're with pulling money out of agency budgets that carried over from one fiscal year to the next. That doesn't directly impact this project, but it could, because we've been having ongoing annual appropriations for 3 years now of $15 million. We're not spending all of that, so that's reappropriating through the budget process. So again, that money's not at risk at the moment, but we want to be cautious and thinking about that. And then probably the most concerning thing is the legislature asked us as we're preparing to testify and present our budgets, to prepare a 7.5% reduced resource proposal. So it takes 7.5% of all of our state general fund appropriations. That would impact our account or our fund for this hospital in 2026. It's not a lot of money. I'm not sure it's all just proposals. we have some discretion in how KDADS presents that package to the legislature, but we just haven't had that, and that hasn't been part of our budget discussions in the last several fiscal years to have reduced resource items. And we'll keep you posted on how that plays out. Again, I'm not concerned about the money for construction, because it's a little bit in the future, a little more concerning for us in terms of operating and getting started. But I think all the money for construction is well in hand, and there where it needs to be. But that is something we'll watch as this budget cycle has a few wrinkles that are a little different than we've had in the past. If something does come up and it's more direct to the project, we'll certainly let you all know, and would hope to the level that you're able to help us advocate for full funding of our project and other things related to services in South Central Kansas, training things that we've been talking about. But anyway, it's a little, we're just a week in. We're all a little worse for wear actually after the first week, so that doesn't bode well, but we'll keep you posted as things develop through the budget process in the next couple of weeks. Any questions for me, or I'll go back to Arena or Tanya about our just kind of project updates so far? Don't see any. Maybe before I have Michelle, invited Michelle Ponce with the Association of Mental Health Centers to give us an update on the Behavioral Health Center of Excellence and some of the training initiatives they're working on that we've been tracking. But maybe before I turn things over to her for an update, we could approve minutes while we've got a quorum. So on the calendar appointment, there's 2 sets of minutes that we need to approve from our meeting on October the 18th and our meeting on December the 20th. Give you a minute to look at those or pull those up.
Scott, this is Mary. I've reviewed them already. I would make a motion to approve.
And this is Joan, I'll second.
Motion to move to approve, and a second from Joan as circulated. Any other discussion about the minutes? All those in favor of approving the October 18th and December 20th, 2024 minutes, please say aye.
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 All opposed, no. Hearing none, they're approved. Okay. I like having that business cleaned up. That was bugging me to go for 2 months. Michelle, if you're ready to present, I think if you've got, I don't know if you've got slides or if you want to share something, but I think we got you access so you could share your screen if you wanted to.
Okay, thank you. Again, my name is Michelle Ponce. I didn't prepare slides today, Scott. I thought I would just do a bit of an oral update. But before I get started, it looks like it's a little bit larger group than the last time I joined you. Is everyone somewhat familiar with the Center of Excellence, or do we need a quick review of kind of what the organization is?
I think maybe just even for the recording and for the YouTube stream, it wouldn't hurt if you've got
Sure.
an elevator pitch. That would be great.
I will do my best. So in general, a Center of Excellence is sort of, it can be organized in different ways. In some other states, they're housed within universities. Ours is a little different. It's not a brick and mortar place per se, but what we have done is we brought together a group of higher education organizations and partners within the provider community focused on behavioral health issues. It's been just about 13 months now since we had our very first meeting. While the long-term vision is really that this will be an organization that really helps impact kind of the behavioral health workforce across the state. We chose to start in the Wichita area for a variety of reasons, not the least of which being the new state hospital that will be coming online, as you all well know, and will need to be staffed. You know, almost every county in the state of Kansas is classified as a workforce shortage area for behavioral health. I don't think that's probably news to anyone. So workforce has been the primary emphasis of the group that we've pulled together. To date, we have established an advisory council We've got commitment of 14 organizations that are active participants, and each of those 13 and 14 board 14 member governing board. So each organization has also appointed an individual with the authority to make decisions and vote on issues. Last legislative session for the current fiscal year that we're in now, FY25, we were successful in getting an appropriation of just under $5.8 million. You can kind of think of that $5.8 million as three kind of buckets. And I don't think when I spoke with you all last time that we had started down the path of those projects, but I'm happy to report that we have. The first bucket, if you will, is funding that is allocated to the University of Kansas, Wichita campus. And we have just this week executed our agreement with them, and we'll be getting that funding to them ASAP. The long-term impact of what that funding is meant to do is expand the number of psychiatric residencies that they provide through their program, as well as fellowship in addiction and substance abuse. Obviously it takes some time to build those programs, but as that program matures, the expectation is that we will graduate 5 additional psychiatrists through that program each year. Not only do we have a workforce shortage in behavioral health in Kansas, we have a pretty severe shortage of psychiatrists. We train them, but we have a hard time keeping them here. So part of our goal is to not only grow the number of graduates, but to keep them here. The second pot of funding, it funds a variety of projects at Wichita State University. We've also executed a contract with them. Some of the main projects at Wichita State include development of a forensic psychology program. We think that will be a big help for staffing the state hospital. We sure hope so. There's funding for a variety of applied learning opportunities for students. There were some social work, scholarships for social work students, some paid practicums for physician associate students who are, particularly focused on behavioral health. They're also developing some new programs in kind of counseling and substance abuse and disorder. So all of those things are underway. And then the third kind of pot of funding, if you will, it's about $2.4 million was set aside very specifically for community and technical colleges anywhere in the state of Kansas that provide nursing programs. One of the challenges that we've discussed with our advisory council is the low wages for nursing faculty in those programs. Oftentimes you will see an RN making around $40,000 annually, which is certainly not anywhere near what they could potentially make if they were working in a different capacity. So maintaining that faculty in order to keep graduating new nurses was something that became identified as a goal. About the beginning of December, we sent out an application across the state. We sent that out through our membership, which are the community mental health centers. I sent that out through public health departments. I asked all of them, if you have community or technical colleges that you work with regularly, make sure they see this. We sent that out also through the 2 associations that represent community colleges and technical colleges. My hope is that they hear about it multiple times because I want everyone that's eligible to take advantage of this opportunity. But so this opportunity has been open for a little over 6 weeks now, and we have already processed and approved 19 applications. That equates to retention funding for 191 faculty members and just under $930,000. And it's been our goal to get those processed in less than 2 weeks, and then most of them have been processed and checks out the door within 1 week. So we're pretty excited about that. We've received just so much gratitude and notes of appreciation and return. So we certainly hope that is making a difference. Looking forward to FY26, it's our understanding currently that all of that funding I hesitate to say is in the base budget because I'm not entirely sure I can define what base budget means this year. As Scott alluded to, there's a bit of a different budget process this year with the legislature has their budget and the governor's office has her budget. They'll be working through the process over the next couple of months to figure out how to get those to align. Whether it does not sound like there is much appetite from legislators to fund anything additional. Although we do have several proposals from our advisory council members that come out that would be in addition to the current $5.8 million. We'll be asking for that. Some of that additional funding would be for the DO schools also interested in expanding psychiatric residency programs. Both Friends and Newman had some proposals for student internships for their marriage and family therapist programs and their social work programs. All of those things we'll be asking for. Now, whether we're successful or not, I don't know yet. There's a ways to go this session to figure that out, but hopefully we do have at least a level amount of funding. Now, going to the legislature and just asking for more funding isn't the only option available to us. We have a longer term strategy that we're hoping to employ, and we have been working with leadership at both KDADS and at KDHE, who is our state Medicaid authority, to explore the idea of revising the state's Medicaid GME or graduate medical education program. This is basically a program that if we are successful in revising our state plan, would allow us to draw down federal matching dollars to some of those funds that we are currently using for the higher education programs. I don't have all of the details, and of course, there's a lot yet to be worked out, but it's our hope that potentially we could fund some of these other proposals with existing dollars. If we were able to take advantage of the additional federal funding that we might be able to pull down. This is not something that will happen quickly. We met with KDHE last week and we've learned a little bit more about how that all works. The state is able to update that GME plan only once per year. And then they've just done that recently. But they've committed to working with us over the next year or so to figure out what our needs might be and how that plan could potentially be revised to be supportive of the efforts of the Center of Excellence. I also heard our Medicaid director earlier this week in front of one of our legislative committees cite updating that GME plan as one of KDHE's goals for 2025. So I'm hopeful that whether it is FY26 or FY27, we will continue to be able to expand and fund additional training and education opportunities. That's really been the bulk of the focus of the Center of Excellence to date. Again, it's an organization that's really been in existence just barely over a year. So it feels like a lot in 1 year. And we're pretty pleased with the success we've seen thus far. We've heard other success stories. Wichita State mentioned in our last meeting that they had such a response to the master's level scholarships that they were able to provide this year. They had more applications than they could fund. And they've also mentioned in a previous meeting that they were able to identify new internship placements right there in Wichita that they didn't know existed until they were in the room with the Center of Excellence meetings. So anecdotally, we're also making some additional connections, and the faster we can get not only new students, but get those graduating students placed with our providers, the sooner that we'll be able to have some impact. It's not, our workforce problem is not going to be solved overnight, but we're going to keep working at it. Aside from money, they've also developed their 2025 legislative agenda, and there are some kind of policy priorities that they've identified in addition to funding, because of course the other side of that coin is how can we reduce barriers to not only get new individuals into the workforce, but keep those that are in. There are a couple of proposals. I wouldn't say yet that we've committed to trying to introduce a bill or anything of that nature, but there are a couple of proposals that we're trying to research and see where they might lead. One in particular is allowing for cross-discipline supervision of newly graduated professionals, which might look something like 50% per supervision provided by their discipline and another 50% that could be provided from a cross-discipline perspective. There are some other states that do this. We've had some initial conversations with the Behavioral Sciences Regulatory Board, the director there. They're having some similar conversations. So we may continue researching that option and see if that is something that might be a useful change for the state of Kansas. That's kind of where we're at to this point. Are there any kind of questions or anything you'd like to know more about?
Any questions for Michelle? I had one, the forensic psychology program at Wichita State. I remember the update. I mean, they talked about with the funding, if it was identified soon or shortly, that they'd be able to start that program, they thought, in the fall. Or did I misunderstand that, or was it recruit the faculty and then start as soon as the faculty on board?
I hope I don't misspeak. My understanding is that they were able to actually start reallocating some existing staff in the fall, even though they didn't have the funding yet. But I don't know that the program is full-fledged yet. And I can actually request an update from them and get a fuller response to you. But I would say it's well underway. I don't know in terms of number of students or exactly how many faculty may be specifically dedicated to that yet, but I'd be happy to get an update on that.
I think they were also talking about maybe having they've started in the Regents process to get a PhD level track approved for forensic psychology as well, I think was another part of their update, which was related to the funding.
And I think they're in the sort of exploratory phase of physician associates doctoral program as well.
Too.
So a lot going on.
Yeah. Any other questions for Michelle about the Center of Excellence? So where this sits in the budget is in our budget, it's KDADS, and our budget hearings are the 29th. And then the public testimony for that, if people would want to advocate for things, is on the 30th of January at 3:30 in the afternoon.
We will be there. And we will be testifying both on behalf of the Center of Excellence and the Association of Community Mental Health Centers.
Okay. Well, I don't see any other questions. Michelle, thanks for the update and your partnership along the way. And
yes, thank you.
I was excited to see that GME was on the health and environments list as well. I wasn't tracking that, but I was happy to see it. So
yes, and I should also just thank not only Scott and Joan and Mary, they're all members of our governing board, and Via Christi has an appointee to the board. So thank you to all of your organizations for your support and commitment, because we couldn't have made any of this progress without all of your help.
You're certainly welcome.
All right.
Okay, that's our agenda for today. Is any other comments or suggestions from anybody else on the panel or updates you'd like to provide from your organizations to the group? Don't see any. Okay, just to give you a little foreshadowing of the future. So we will have a meeting in February, and then our last meeting will be in March. For February, one of the panel recommendations was to get a briefing on the state structure for children's services, including justice-involved children. So I've asked our behavioral health team here at KDADS to put some information together for that and provide a presentation. We haven't talked a lot about children's services or youth services, since our hospital is going to be primarily for adults, but there was some interest in gathering more information about that and sharing it. So we'll do that in February. And then just our regular updates. But are there any other topics? I've been reading through every other day, go through the recommendations and see if there are other things we need to be highlighting. And we've, with the advisory, not the advisory panel, the foundation, setting up a foundation board and a citizens advisory group. That's a recommendation. The children's update is a recommendation. Then some of the training things are recommendations as well. So we'll keep you updated on those. But if there are other topics that you'd like to hear about, be happy to work those into the agenda as well for February. If you've got something now, that's great, or just drop me an email, let me know, and we'll work on that. Probably looking at, I think the 20th is the third Friday in February. We'll probably look at that date. Any other business for today? I'm not seeing anything. Okay. Well, I'll adjourn our meeting for today. Thanks for your time and attention. And again, if you have something that you want to see on the agenda over the next couple of months, let me know, and I'll try to send out an email as we get other insight into the budget process. If we need some help for advocacy around that, yeah. If it's too much and you don't want to be notified, please let me know to take you off the list. But I'll assume that you want it unless you tell me different.
Thanks, Scott.
Alrighty, you bet. Okay, thanks everyone. Have a great weekend.
Thank you.
Thank you.